Hines VA is home to a number of amazing services and programs, but one that stands out is our neurology team. Headed up by Acting Chief Dr. Clea Coletta, the neuro team is diverse with multiple specialists that aid veterans in the clinic setting, but also in research projects. The neurology team also specializes in Agent Orange and other service-connected illnesses that veterans are diagnosed with.
The majority and the bulk of any kind of studies with regards to toxin exposure, whether it be Agent Orange or Camp Lejeune, trichloroethylene, is done here. And I'm very fortunate to have a wonderful team that works with me, and we have been doing quite a bit of research with regards to the exposure to toxins at Camp Lejeune and the development of Parkinson's disease and other neurologic conditions as well. So very lucky that the VA has all of these opportunities to increase research in this very, very important arena to help our veterans to the best of our ability.
Dr. Coletta also heads up her own multidisciplinary movement disorders clinic. In this clinic, Dr. Coletta treats patients with Parkinson's, tremors, and other movement disorders. One of Dr. Coletta's patients is Jeffrey Wiesman, a U.S. Army veteran with essential tremors. Part of Mr. Wiesman's treatment is deep brain stimulation.
When I first came to neurology, it was because I had the tremors. And I was seeing a doctor who I don't remember from here. And when Dr. Coletta came on board, I was thankfully given her as my doctor. And I think it was our first meeting together. She goes, "Oh, we have this new thing, it's the DBS." She goes, "I think you're a good candidate." She showed me what it was, what it involved. And I'm like, yeah, let's do it, because at my age, I wanted to have a life. The surgery was in 2 steps. First, putting the probes in and the battery, and the second one was, you did a slice on my head and hooked the battery system up.
So this is with stimulation off. Go ahead and touch my finger.
The day they turned me on, my father was still here, and I went to where he was living, and I said, "Hey, Dad, you want a cup of coffee?" Which I'd never been able to do. I went to kind of grab 2 cups, held it like this, walked to him and goes, "Oh my God, you're normal." And that's what I wanted. I wanted to have some kind of normalcy in my life, and because of it, Dr. Coletta gave it to me, and she's my hero. I would say anybody that has Parkinson's or essential tremor, I'm not going to tell you to get it, but I can highly recommend having it done. If you want some kind of a normal life again, for where you were, say, 20 years ago to now, it's worth it.
In addition to deep brain stimulation, Dr. Coletta also uses other devices to help treat veterans and give them back their lives.
One of my personal favorites is something called Kala Kick. Basically, it's a neurostimulation device. It has 2 kind of stimulation pads in the band, and you put that over your median and radial nerves in the wrist. What happens is when it gets stimulated, it sends these signals back up into your brain, into the thalamus. Patients can use this an average of 5 times a day. They can use it about a half hour before they eat, before they write, before they basically do any task where they want their hands to be steady, and this should actually give them the freedom to be able to do that. For migraine, we also have another couple neuromodulation devices. One of them is called Cephaly, and basically it is a stimulation device that is attached to the forehead. Patients wear this for about 20 to 30 minutes a day, and it can be used as a preventive or as a rescue when they have headaches. And another device called GammaCore, which is actually another kind of handheld device that you put over your vagus nerve. Great thing about this one is you use it for 2 minutes, and if they use it on a regular basis, that can be a preventive as well. So they could use it 1 to 2 times a day, and they can use it as needed too. So when they need it, they have this little pocket that they could pull out and be able to decrease the frequency and intensity of their migraines.
Dr. Coletta and her team are currently working on several research projects, ranging from improving the efficiency of patient care to new innovative techniques for treating neurological illnesses. Dr. Sandra Kletzel and her team, comprised of Alexandra Umbarger and Sadie Walker, care for veterans each day that suffer from illness, such as Parkinson's. They believe they are the best resource for veterans seeking help and care, as they understand the veteran population and what they need to live healthier lives. One of the goals of the team is to make veteran healthcare less invasive and more efficient.
Veterans with Parkinson's disease tend to have these complex chronic behaviors. There's a lot of drug interactions, there's a lot of drug side effects. So us with Dr. Coletta are very interested in a non-invasive neuromodulatory, non-pharmacological approaches to managing Parkinson's disease.
As well, it makes it more veteran-centered because they don't want to take more meds. They don't want to do things invasive into their bodies. So it's veteran-centered as far as taking into account everything that they require or desire for their own care of their own bodies. So that's also really important, right? Not everyone can tolerate an MRI, but they may be able to tolerate this kind of approach to understanding their disease course.
I think it's important for the veteran to know that their provider cares about them, and I think, that's not necessarily something that they may get everywhere, anywhere they go. With Parkinson's, some guys feel self-conscious about it, so sometimes it feels like the whole world is staring at them, and it can feel lonely. So I think when they come here and they see that we care about them and just the way we interact with them, I think it's important.
We treat them all like royalty.
And one of the things with our veterans and the military exposures and the neurotoxin exposures, this can really change the profile of the symptoms that our veterans with Parkinson's disease have. And so looking at these non-invasive approaches to manage symptoms, we're hoping it's a safer way to kind of do a more global approach to care.
Well, and that's why it's so important that I've seen so many veterans that are like, oh, we didn't know what was going on. I've been to so many different neurologists until I met with neurologists at the VA. Until I met with Dr. Coletta, did she figure out what was going on? And so that's why it's so important for these veterans to get the care here. It is a specialized area. You can't just go see neurologists elsewhere. They just don't understand the complexity of the folks that we see here.
Two veterans that work with the team are Leonard Garza and James Harry, both diagnosed with Parkinson's and are eager to help their fellow veterans by participating in the research done by Dr. Klutzel and her team.
Oh, it's fantastic. We need to continue doing this. It helps me out. It not only helps me, it helps them. So with us working together, it's twofold. It helps out everybody.
Oh, anytime that they call, I'm going to be here, unless there's something wrong with me mentally, physically, but I'm going to do anything I can to help the VA with their research for Parkinson's and the research team that's doing it.